Hi, it's Dr. Ron Kaiser. Good to see you again. And I'd like to talk today a little bit about greetings. Several times a day I run into somebody who I may have seen recently or not recently at all. It's not uncommon for me to ask something along the lines of, "Hi, how are you doing?" It's kind of a greeting, and most people will respond uh, along the lines of doing great, how are you? Or doing well, how are you? In general, it's a way of acknowledging the other person, responding, and kind of moving on with our conversation. Occasionally, we'll run into somebody who, when I ask them how they're doing, think I really want to know, and then they proceed to give a medical report. Now, I am always interested in any acute problems that a person may be having. So, if since the last time I saw them, if they've had surgery, if they've had root canal, whatever it may be, I'm always glad to be brought up to date. I can offer whatever empathy seems appropriate and so on. But some people tend to socialize around their ailments. Some people are ready to discuss that as their major topic of conversation. So asking somebody like that, "How are you doing?" really seems to give them license to express a litany of complaints that can bring both of us down as the conversation proceeds. So, my proposal for today is to think selectively about this. If you have a history of knowing that the person's going to respond appropriately with a "how are you doing?" to, "thanks for asking," or whatever it may be, then that's okay. Ask, "Hi, how are you doing?" But I think we ought to all have alternative greetings in our back pockets for those people who we know will run with it as a medical report, or or we don't really know how they're going to be reacting. So something like, "Hi, it's nice to see you." Something along those lines that acknowledges that we are happy to see them, that we are concerned about them, and that really does allow them to point out something that may have changed since the last time, whether they've experienced a loss or whether there's been a medical problem and so on. Again, I don't think it's inappropriate to point those things out. I think it's inappropriate to have a whole list of chronic conditions that then becomes the subject of your major interaction with the person. And if you're the kind of person who tends to really feel the need to tell anybody that you run into how you're doing, make sure that it's an appropriate thing as opposed to just your normal way of interacting. Once you reach a certain age, for example, you can probably always find something going on in your body or in your mind. As we do this video, I have a temporary tooth in place to replace a tooth that fractured and waiting for a crown to be made. Now, do you really need to hear that? Couldn't I have come up with a better topic? On the other hand, I don't mind doing that if I put a period on it. So think in terms of, if it's appropriate to tell the person, "Hi, it's nice to see you," or "it's good to see you," or whatever kind of thing gets us off of initiating a medical report. I think that tends to be healthier for the brain as well as healthier for the conversation. So give it some thought. Look forward to your thoughts on it, and look forward to your maybe giving it a little bit of thinking before you automatically ask the wrong person how they're doing. Be empathic, but also don't take the conversation in a direction that it doesn't have to go, because it may not lead to anything else other than just, commiserating. And there are better ways of conversing than that. So until next time, it's Dr. Ron Kaiser, looking forward to seeing you again and hoping that you're staying well, staying positive, and moving forward. And I hope you're doing well.